Welcome to the course Internal Family System Advanced. If you haven't already taken the other course, which is the basic of IFS, you have to first take that course and then come back to this course. Internal family systems is a therapeutic approach that focuses on understanding and working with the different parts or aspects of an individual's personality or psyche. IFS suggests that each individual has different parts or subpersonalities that may have different beliefs, emotions, and behaviors. These parts are organized in a system where some parts take on protective roles while others carry pain, fear, or trauma. IFS aims to help individuals identify, communicate with, and heal these different parts of themselves so that they can function in a more integrated and harmonious way. In IFS, the therapist helps the individual access and communicate with their different parts, understand their roles and functions, and work toward resolving any internal conflicts or negative patterns of behavior. IFS can be used to address a wide range of mental health issues, including depression, anxiety, trauma, and relationship problems. IFS was developed by Dr. Richard Schwartz, a licensed marriage and family therapist, in the 1980s. Dr. Schwartz had been practicing traditional psychotherapy for several years when he began to notice that many of his clients had conflicting internal voices or parts that seemed to be driving their behaviors and emotions. He realized that these parts were often protective but could also create internal conflicts and contribute to negative patterns of behavior. There are several reasons why IFS is likely to become more popular in the future. First, the approach has a strong empirical basis, with research demonstrating its effectiveness for a range of mental health conditions. Second, IFS is a flexible approach that can be adapted to the needs of individual clients, making it a valuable tool for therapists working with a diverse range of clients. Finally, the approach has a strong focus on client empowerment and self-leadership, which is increasingly recognized as an important component of effective therapy. Let's learn some of the techniques that you can use in IFS therapy. Parts mapping. This technique involves creating a visual map of a client's different parts and how they interact with each other. It can help clients understand the different roles and functions of their parts and identify which parts are protectors and which are exiles. Self-leadership. This one involves helping clients access their self, which is the core, compassionate aspect of themselves that can provide guidance and leadership to their parts. Clients learn to connect with their self and lead from that place, rather than being controlled by their parts. Dialogue with parts. This one involves having a client directly communicate with their different parts, either through visualization or journaling. The therapist can help facilitate the dialogue and encourage the client to speak from a place of curiosity and compassion toward their parts. Unblending. This technique involves helping clients separate themselves from their parts so they can observe them objectively and with compassion. Unblending can help clients develop a greater sense of self-awareness and reduce their identification with their parts. Internal self-relations. This one involves helping clients develop a relationship with their internal world, including the parts and their self. Clients learn to relate to their parts with compassion and curiosity, and to access their self for guidance and support. Unburdening. This technique involves accessing and releasing the emotional burden carried by a part. The therapist may guide the client to express the feeling and belief associated with the part and then help the client to separate from the part and release the emotions. Dialogue with the part. This technique involves the therapist encouraging the client to engage in a dialogue with their parts. The therapist may help the client to understand the perspective of each part and foster communication between the parts. Inner critic work. This one involves identifying and working with the client's inner critic, which is often a part that judges and shames the client. The therapist may help the client to understand why the inner critic developed and how it's trying to protect them, while also teaching the client to develop self-compassion and self-acceptance. Exile work. This one involves accessing and healing the wounded inner child parts that have been exiled from the client's consciousness. The therapist may guide the client to reconnect with these parts and provide them with the love and nurturing they need to heal. Self-energy. This technique involves helping the client to connect with their inner self-energy, which is a state of calm, clarity, and compassion. The therapist may help the client to access this state and then use it to facilitate communication and healing between parts. Integration. This one involves bringing the client's parts together and integrating them into a harmonious whole. The therapist may guide the client to recognize that all parts have positive intentions and can work together to achieve a common goal. Visualization. This technique involves using imagery to help the client connect with their parts and facilitate healing. For example, the therapist may guide the client to imagine a safe space where they can communicate with their parts, or ask the client to visualize a loving and nurturing figure that can provide comfort and support to the wounded parts.